Hi, everybody. Welcome to Community Q&A, brought to you by the Herald and News. My name is Steve Rosen. With us today is Stan Gilbert, the CEO of Klamath Basin Behavioral Health. Welcome, Stan.
Thank you.
Glad to have you here. And just give us an overview. Who is KBBH?
KBBH, Klamath Basin Behavioral Health, is the community mental health program for Klamath County. That's an assignment by the state. Every county in Oregon has to have one, and we're it for Klamath County. We're also designated as the local mental health authority, which means we have responsibility for planning, organizing, and overseeing mental health services in Klamath County.
Fantastic. Now, you started a long time ago. Where did you start? How did you start? And where have you come from since?
Klamath Basin Behavioral Health actually started in 1980. Back then it was known as Klamath Child and Family Treatment Center. And over the years we've grown. We've added programs over time. I think I arrived in 1986, and when I arrived, I think we served maybe 50 consumers a year. In the last 12 months, we've served about 8,000, so we've grown quite a bit.
That's incredible. What's next for KBBH?
Well, healthcare is changing, and there are certain priorities in Oregon that we're really striving hard to meet in our community. For instance, one of those priorities is to integrate behavioral healthcare, which is really a combination of mental health treatment and substance use treatment. We want to integrate those services more and more with medical care. So there's a big priority, and we're certainly included in that, to work harder to integrate what we do with what your primary care doctor does and make sure that there's a more seamless overlap between those services. For instance, we're in the next few weeks, we're starting a primary medical clinic on site at our behavioral health facility, in order to make sure that those individuals with a severe behavioral health disorder who typically don't get medical care. In fact, national statistics indicate that an individual with a serious mental illness actually dies about 29 years earlier than people in the general population just through lack of proper care.
Wow. So people who would like to take advantage of the services you offer, they just come directly to you, they call, they go online. What's the best way for people to reach out?
We really want to make it as easy as possible to receive what we do. One of our concerns is that the stigma against seeking out behavioral health is powerful. Traditionally in this country, it's been thought of as a character flaw or a moral failure or other kinds of things. The idea that you can snap out of it is not accurate. It is an illness, and it's often brain disorder, biochemical imbalances, and things that are treatable. Trauma actually plays a big part in mental illness as well. But it's very easy to reach us. You can call our number, 883-1030, 541-883-1030. And somebody will be answering the phone. You can also just walk in to our main facility at 2210 El Dorado. And if you are seeking help or think you need some help or know somebody that does, you can just walk in and we'll make sure that somebody's there to available to help you.
So for people to take advantage of their services or to seek help, you make it relatively easy for them to do that then.
We really try to do that. We really do. It's important that people have immediate access. When you decide you need help, you need it.
Right.
And having to wait for that just doesn't work. So we try to make it as easy as we can for people to receive services. So you can call our number, 541-883-1030, and there'll be somebody on the phone that can help you or set an appointment. But you can also just walk into our facility up on El Dorado, 2210 El Dorado. If you just walk in, there will be somebody there that'll be glad to provide some services and direct you in the right location, the right direction.
Fantastic. Is there anything else you'd like our viewers to know about KBBH, the Klamath Basin Behavioral Health?
Well, we provide a broad array of services. In fact, we intentionally do that because we want to make sure that whatever somebody's needs are, they can come and find a service or a program that will fit that need. The idea of somebody having to fit our services just doesn't work. So we want to make sure we have a broad array of services available to fit the needs of whoever shows up. And we're very diverse. We have a lot of things available, from very high acuity services, very intense levels of care, to very low intensive levels of care. So everything from counseling, support services, home visiting, all the way up to civil commitment services we have available.
Fantastic. If there's anything else you'd like our viewers to know about KBBH, what would that be?
There's been so much stigma relating to mental health over the years. It's been characterized as a moral failure or a character flaw, and those things just aren't true. We know that that behavioral health problems often have a history behind them. We know that they are often produced by chemical imbalances or what you might call chemical imbalances in the brain. Certain neurotransmitters don't line up correctly. And those things can be treated successfully. It is a medical condition. It is an illness, and treatment works. So I would encourage people to seek out help if they think they need it, or if they know somebody who they think does.
Fantastic. Well, thank you for joining us today and letting everybody know what KBBH is all about and how they can get involved.
My pleasure.
All right. That's Community Q&A with the Herald of News. My name is Steve Rosen. Thanks so much for watching. We'll see you again soon.